Setting a record high for new COVID-19 cases in Tennessee, there is new criticism tonight that there simply aren't enough people tracking the infected. Chief investigative reporter Jeremy Finley found people who'd come in direct contact with COVID-19 patients who say they have yet to hear from any contact tracers.
Randy Tatel's first exposure was when he invited a friend over to watch a replay of this Preds championship game. Days later, that same friend delivered him groceries. So when that friend then tested positive for COVID-19 and told investigators who'd she come in contact with, Tatel kept waiting for a call.
I never got contacted by a tracer at all.
And he's not alone. Another man who shared his test paperwork with News 4 Investigates says neither he nor his roommate, who tested positive for the disease, have been contacted by a tracer. Democrats say it's proof the state does not have enough people tracing the sick and those they've come in contact with.
Our contact tracing resources are woefully inadequate, that many people who are testing positive are not receiving sufficient follow-on contact.
The State Department of Health estimates they have roughly 700 contact tracers across the state. As of today, a News 4 Investigates analysis shows there are roughly 12,292 active cases, not including the people they've come directly in contact with. In a news conference this week, the commissioner of the Department of Health said they're trying to hire another agency to help with the work.
But right now we're able to keep up, but it is something that's on our radar.
Democrats argue the state is moving too slowly. Tatel says his experience proves it.
It's stunning where we're at as a nation in terms of trying to combat this virus.
Jeremy Finley, News 4 Investigates.
Now, we did reach out to the Metro Health Department. A spokesman says they have made contact with 90% of those who tested positive and those they've come in contact with. That leaves roughly less than 10% who still have not been contacted.